Cleveland. Cleveland is the poster child of everything that is difficult in the current economy. And I'd like to begin by positing a few uncomforting thoughts in response to the uncomforting presentations that we just had about the economic situation as a whole. And I do this in a way of hoping that you can pleasantly ask people to get out of their comfort zones. That's what basically I want to do here. How do you do that when we're already sort of out of our comfort zones? There are a number of paradoxes in this economy that I think are worth contemplating, not only for what they mean with their policy implications and the work that we do and all of that, but what does all of this mean with regard to our own lives and those things which are not quantifiable? Phil and I were having a conversation about this earlier on. So then, for example, how do we deal with, I don't know how you all feel about this, but I had a great time last night. Carol and I went down to hear a bluegrass band down the street in Alexandria. I know some of you went to see a belly dancer. So whatever, the flavor of the evening was for the rest of you who didn't do either of those things. Here we are, advocates for social justice, improving the quality of the lives of people who are downtrodden, the poor, so on and so forth, enjoying the hell out of ourselves in Alexandria, eating good food, enjoying the amenities of a fabulous community. Life on the street is great. They've got more amenities for the dogs going up and down King Avenue than what we have in Cleveland for people who are homeless. Okay, how do we deal with that as human beings? There's one paradox. Getting to some of these other issues here. We as an organization have taken a lot of serious flack in the last year because we've reached out to the political right in the state of Ohio to try to figure out, okay, what is it in the intellectual ferment on the right that is going on that is so at odds with the way we see the world? There are more interesting ideas and ways of looking at things when you engage smart people, smart conservatives in conversation, at least there have been for me and some of the others who've done this, than what I've heard on the political left in years. In listening to the presentation, how does that manifest itself? In listening to the presentations we just heard, we heard about evidence-based things. We're all about evidence-based things. Joe Ahern's award here today tells you we're all about evidence-based things. But evidence-based things, solutions, almost by definition, have to look backward because it's evidence of what has happened and has accumulated. At the same time, we're always talking about exciting new ideas, but we want those ideas very much to line up with that evidence base back here, and especially the one that we're comfortable with, one of which is increasing public spending will contribute to a growing economy. Okay, well that's been the case for the last 80 years. It will produce more jobs. We have had unprecedented spending, another paradox, the last 3 years in the public sector, and it has not produced jobs. So where's that money gone? What has happened? What is the underlying reality there? Have we simply found a clever way of restoring the balance sheets of banks that were way over leveraged and basically used that federal debt to undergird the financial sector in the United States or perhaps globally? It was just simply way over leveraged and was not in a position to take care of itself. That money went somewhere, we don't know. But what it didn't do is it didn't produce jobs. So when we listen to people on the political right saying, hey guys, where's your recovery now, sort of a thing, they're asking a good question. One of the most interesting authors, this was a really conservative guy in Ohio who turned me on to this guy. He's an Obama Democrat, or he is a Democrat who voted for Obama. His name is Walter Russell Mead. Check out his blog. For those who want to get willing to take the leap and get out of your comfort zone and look at what somebody on the left is thinking about these kind of big issues. He has written a series of things that he calls Liberalism 5.0. He goes through the history of what liberal has meant over the course of American history, and that the New Deal model, the blue state model as he calls it, is effectively dead. That all of the ferment that is happening on the political right, in fact, does make sense. And the question for liberals, however you mean that term, is what does the next version of this look like in a world that has transformed fundamentally in the last few years? I highly recommend him. Another paradox. Those of us who want universal health care coverage, we have embarked on this thing. You heard this morning that we have done all of these contortions to get this health care reform bill passed. And what we have done as a result of that is maybe we will be able to cover half of the uninsured at the end of this period of transition. In the meantime, healthcare spending, contrary to the thought that spending has gone down, Medicare spending hasn't gone down, and it isn't going to go down. It's never gone down from one year to the next. Medicaid spending may go down for a year or two here in some states, but aggregate spending on public health care continues to track, and has tracked for decades, what happens in the private sector. That growth in the healthcare sector is human services. That's what our organization is all about. But what we would have been doing on healthcare related things 40 years ago and what we're doing now, the hospitals and the big health systems are part of a private economy. They have nothing to do with the rest of the health and social services world. They have nothing to do with public health. How do we deal with unprecedented spending on healthcare while at the same time saying spending on human services is a problem? We need more. We couldn't very well ask for anything more. A huge amount of the job growth in Cleveland, not a huge amount, the only job growth that has happened in the last 10 years has been in the healthcare sector. This is happening at a time when the costs of healthcare are approaching 20% of GDP and are sinking the capacity of industries that are competing in the global markets to price themselves effectively to export. Cleveland, at one time, we made things there. We don't make much there anymore, but the cost of healthcare in Cleveland, which is growing, is in effect a tax on everything else that's going on in the economy. And as that sector goes up and we say, hey, this is jobs and progress, this is growth, we are in effect taxing, without it going through the public side, every employer in town to pay those rising healthcare costs. Cleveland Clinic and University Hospitals in Cleveland today. Cleveland Clinic is the second largest employer in the state of Ohio. They employ 40-some thousand people. They are the steel mills of Cleveland today. They are off the tax duplicate. They're a nonprofit corporation. They pay no property taxes into the Cleveland Municipal School District. And while their employees do pay taxes into the municipal income taxes, which we have in Ohio, they're not contributing on the public school side at all. Have we reached the point where the organizations like them and like ours should be paying a tax on our operating margins? That is there still utility with the nonprofit sector having grown to the extent it has? Is there still utility in having complete tax exemption for nonprofit organizations? Does that make sense going forward? If that's where the economic activity is, why do we continue to defend a tax exemption? I'm not talking about the contributions we get from donors and that sort of thing. I'm talking about when we turn a profit, and we have to every year, why should we be exempt from paying a portion of that back to the government, which is in fact our biggest payer, directly or indirectly? There are a whole bunch of issues along those lines that one has. There was one other thing I wanted to mention here. Technology. Have we reached a point where all of these investments in technology are in fact improving productivity to the point that we are displacing employment at a greater rate than what we are producing new jobs at here? The argument has been for decades that new technology produces a net increase in jobs, that as people no longer have to work at a lathe in a machine shop, we don't have any machine shops left, but 10, 15 years ago, we had a lot of them in Northeast Ohio. They're all in China now. But there was a time when people used to work, you know, at an industrial lathe or something like that and spend hours a day working at it. With CAD technology and that sort of thing, this is all done by machines. And it's done cheaper by machines over there than the machines that we have over here. So for all of that displacement, have we reached the point that technology and productivity due to technology is displacing jobs? And if that's the case, what are the implications for those of us who are trying to support productive lives? Yesterday, and I'll shut up here in just a minute, these paradoxes are things that while we're trying to deal with them at the national level, you could feel yesterday, or was it this, I guess it was this morning, the disconnect between the way the policy is happening here in Washington and what are these people thinking? This debate has nothing whatsoever on either side to do with the lives we are living in our own communities. You're talking about health care. You listen to the Democratic side of the argument that they're trying to defend a bill that nobody really likes that I've ever spoken to. And the Republicans that are on a mission to try to use this as an excuse to gut the whole thing. They can't be serious. They can't be serious. Look at the size of the industries, hospitals, doctors, and so on. They're constituents that are dependent upon that revenue. But nevertheless, you've got this debate happening here in Washington. It has nothing to do with what we're dealing with, the reality of things on the ground in our communities. How do we end up with that situation? And it's true not only in healthcare, you can go from issue to issue across the board. So as we think about these slides, this jobless recovery that we're having, if in fact it is a recovery, and how we live our lives in our communities, how we try to plan in a mixed market economy for health and social services through the charitable sector and through the public sector, kind of a command economy versus what we're trying to see happen on the growth side in the private economy. Now, one other thing, I don't know about your communities, but every major investment that produced jobs in Northeast Ohio in recent years has been the result of public expenditure. Hospital bonds, bonds for new sports stadiums, we have 3 of them in Cleveland, bonds to float a new Medical Martin Convention Center, public approval and public financing to help gin up casinos, which were a little bit late getting into the game, but you know that's productivity in this economy. All of this is coming from the public side. Where's the private money? Houses, we're tearing down 3,000 houses a year in Cleveland. The good news on this is that there's lead abatement happening at the same time on those properties. The bad news is that that tells you, I mean, we've got this housing surplus in Cleveland that is substantial. People are talking about ginning up the housing industry. What do we want to gin up a housing industry for in a community that has a declining population, in our case significantly? So all of those paradoxes make it awfully difficult to think through how we do things on the ground. The people here are going to tell us how their communities have addressed and solved all of these problems. Sitting right here. So we know Martha and Jacqueline from out in Dallas. At least I know Martha, and I kind of met Jacqueline yesterday. And I think they're going to go first. And then we've got Mickee Brown from Jacksonville, who's going to speak. And then finally, Tracy Viselli. I'm from Cleveland, and I would say Viselli, but okay, Viselli it will be, who's with Action Alexandria, and a community that's been a marvelous host to NAPC the last couple of days. Yeah. And she will tell you that it's all her doing. So I'm going to let them take it over, and I'll come up and referee questions afterwards and go back to my seat. But Martha, why don't you and Jackie go ahead and get started?
Well, Jackie and I are going to do a tag team. I was okay until John said we had the answers and the solutions. I was okay with stating the problems, but and I want to take a little different tact. I'm going to talk to you a little bit about the America Speaks Forum that took place last June, a national electronic town hall meeting that involved 3,500 people all over the United States. I'm going to talk a little bit about that, and it had to do with how should we reduce the federal deficit. That was the bottom line of the story. And out of that, believe it or not, came a consensus, a national consensus of some steps that everybody agreed we could take and that we could live with. And it, as John says, it doesn't look anything like the discussion that's going on now. But when I look at this report and when I remember that discussion going on, it gives me some hope, because we really did talk about the kinds of things that we're talking about among ourselves. They were in that discussion. Those issues were in that discussion. So I want to go through just a little bit of that to let you know that there are deliberative people who are average walk of the life people in the community, not esoteric thinkers, whose demography in each of the communities that participated matches the census from those communities. So age, ethnicity, background, economics, the whole bit matches the census for each community. And they were very carefully recruited on a first come, first served basis, but you know, the first people, the first 20% of the population that's under 28 that signs up gets to participate. And then we'll make sure that that matches in all the categories with the others. There, Karen, your community was a host also in Overland Park, right? Were you on the satellite, or were you one of the other groups? You were on the satellite.
Yes.
Yeah, the satellite hookup. And you know, this technique of having electronic town forums has been used repeatedly by America Speaks over the last several years, and I think some of you have participated on other subjects. This was the third time that they came to Dallas on a subject, so we're kind of old hands at this. And the numbers I'm going to give you are the national statistics. If you want them for any of the sites, any of the cities that participated, America Speaks can give you that back data for those local areas. And the booklet that's been put around is the final report that they put out. Household income under 25,000, 17% of the participants fell in that category. 25,000 to 50,000, 21%. 50,000 to 75,000, 20%. 75,000 to 100,000, 16%. And households with over 100,000, 26%. And that very closely mirrors what the census says for the United States. So that was the profile economically. Age range, 10% were between 17 and 24, 9% 25 to 34, 9% 35 to 44, 18% 45 to 54, 29% 55 to 64, and 25% over 65, showing the aging population. And that's what our demographics look like. Views on economic and fiscal issues. Liberals, these were self-declared, however you want to describe yourself. Liberals, 25%, somewhat liberal, 18%. Moderate, 23%, somewhat conservative, 13%, and conservatives, 20%. And so that bell curve looks like, you know, the self-declared bell curve of our country. Race and ethnicity, we had 16% nationally that were African American, 3% that were Asian or Asian American, 68% that were Caucasian and white, 5% that were Latina, Hispanic, 1% Native American, 5% of the people who described themselves as more than one race, and 3% other. And that very closely, again, mirrors the census. So you can see that 3,500 people that actually participated that day are a cross-section of the United States. They were asked a series of questions in a very well thought out format that said, how would you reduce the deficit $1.4 trillion by 2025? How would you go about doing that? What kinds of choices would you make? What kind of choices could you live with? Very carefully thought out deliberative process conducted around small round tables, tables of 10. And each person at the table was encouraged by a trained facilitator to participate and talk in that dialogue. They had to weigh the trade-offs of the kinds of challenges they were facing, and they had to come to consensus, which we're all familiar with as a model, but lots of groups are not familiar with coming to a consensus, and they had to do that. And this process proved two important things. One, that people who don't know anything about each other, and these were strangers, they were put at tables randomly, so you couldn't come and sit with 9 of your friends. If you came with 9 friends, there was one of you at each table. People who don't know each other can come to consensus. And number two, people who The accusation has been made that the general public can't understand these issues, they're too complex. And this proved that that's not true. That the general public can understand these issues and can make a consensus decision. Very important, because how many times have your legislators said this is so complex nobody can understand it? Well, it is possible to understand it, you just can't get it in a soundbite from them. So I'm going to give you the absolute nutshell findings from this, because I think this is really important to know. And the chances to make cuts and the chances to look at revenue streams went all the way across the board. I mean, everything started out on the table and came down to a reduction in defense spending of 15%. 85% of the people supported that. That's a huge number of people supporting at least 15% cut in defense spending. Not a 90% cut, not a 1% cut, but a 15% cut. And you're going to see a theme running through how much of what people said they wanted to do. Health care spending, reduction in health care spending, 5%. 62% of the people said 5%. They thought that they could cut out 5% of the spending somehow and still have adequate and appropriate health care, that there was something they could do. Spending a cap on payroll taxes. You know, right now you pay Social Security tax up to a cap and then you don't pay any more. And there was discussion on the revenue side of, well, should we raise the amount on which we pay Social Security tax? 60% of the people said yes, raise it, absolutely. We're willing to spend that, we're willing to pay that additional tax. Amazing.
I bet they weren't the high earners.
Right.
You can look in the data, and some of them were. Yeah, no, I mean, to get 60% of the people to say that, you would have had to have people earning over, I mean, I can tell you what the percentage is. There would have had to be 48% of the people would have had to say that. 48% of the people would have had to say, so of that 62% that said it, a whole bunch of them were in those categories. And they figured they would pay Social Security tax above the $104,000 level now. Income taxes on those in higher brackets. Now, here we are talking about them, or 48% of the people, we're talking about us, you know, the same people. And of the people who said raise payroll taxes, 60% said do that. Raise it. So you're not just talking about somebody else, you're also talking about yourself when you're saying that. That was what was so important in this exercise. Establish a carbon and a securities taxes. Carbon tax for increasing or decreasing your carbon footprint, and a securities tax based on how much you're trading in securities and commodities, stock market transactions, whatever. 54% of the participants said they supported a carbon tax, and 50% said they supported a securities tax. That's a pretty big percentage of people saying we're willing to look at an issue that, have you ever heard about discussion about that recently? Not recently. And the other big one was a question of whether or not to reduce Social Security benefits or establish a value-added tax. And uniformly, there was a rejection of reducing Social Security benefits across the board. It was a non-starter. And only 24% of the people supported creating a 5% VA tax, value-added tax. Not much support for putting a value-added tax across the country. Now, that's a nutshell, and you can read all the fine pieces in here. But based on that, the participants were then asked at the end if there was any message that they could send to Washington, what would that message be? And here, all of us as planners were thinking, oh my God, you know, this is going to be a free-for-all. And you know they came out with two statements? This again was consensus across the country. They came out with two statements. And one is, abandon the failed politics of partisanship. We don't like it, it isn't working, stop doing it. Came out uniformly. And the second one, stop demonizing each other and expect us to trust you. If you don't trust each other and you don't behave to each other, why do you think we would trust you? Those are the two public statements that came out uniformly across the country after having been asked an open-ended question. That says a lot about public discourse. It says a lot about people giving voice to what they really think and what they really believe and their frustration. The challenge then was for the output from this exercise. Where does it go? On a shelf? No. It went to the Joint Commission, to the Bipartisan Commission of the administration. And it was a lot of the background information that was used for that Bipartisan Commission as it met through the summer. Probably 2/3 of this report was the basis for that commission. There were some pieces they didn't agree with, and there were a couple others they wanted to put on. But 2/3 is a sizable chunk of public input that went into that dialogue. And now where is that dialogue? Where is that dialogue?
On the shelf.
Where is that discussion? And I will tell you that behind the scenes there is a very small group of 6 people that are trying, and it's a bipartisan group, that are trying to revive the nuggets out of this and inject them as fact into the rhetoric that's going on nationally. Whether they'll be able to succeed in doing that or not, I haven't a clue. It's my only hope. I'm trying to give you a positive message today. Because there is a lot of positive messaging in this report, in that people said, this is how much pain I'm willing to bear. This is what I think our country could still be strong with, but we could accomplish the deficit reduction. And we're willing to participate in doing it in this way. Very different dialogue than what we're hearing in the disconnect that John described. So based on that, then Jacqueline's going to talk a little bit about what's going on locally, state, Dallas, because this took place in Dallas, and so we had 600 people in Dallas who were part of this discussion. And they're wondering what happened to the discussion too.
Well, our legislature didn't listen to any of that.
That's right. And some of them were there.
I'm here to talk about the local impact of the economy on Texas and Dallas. And I could subtitle this, Why the Makers of Zoloft Are Still in Business. Because this was really quite the depressing story. When the economy is bad, of course, it affects people to meet their needs, their basic needs, things like food, housing, electricity, utilities of all sorts, and they're in need of services and public benefits. The major impact areas in Texas are employment, housing, food, education, health, mental health services, and services to seniors and children, and nursing home care. That would be every vulnerable population that you can name. And you hear Vanessa complaining about what's going on in Texas. I'm here to bring it to you for real. I'm not sure if all states have this, but we have a legislative study group. And what this group does is they look at all of the bills and they put it in plain English so that everybody can understand it. And they give you the impact of what that would be if this bill passed the way they have it proposed currently. And our legislative study group, our legislature just entered into its 82nd session. We only meet every other year. So what we do now will last until
Because of the cattle.
2013. And we're stuck with it for 2 years, no matter what happens. When we started the session, there was a $27 billion shortfall for our state budget. So I didn't realize our session would be recorded today, and I'm known for somebody who doesn't hold their tongue. So anytime I say something that is not politically correct with community council, Martha can get the cut sign, and you guys will know that that's something that I'm personally saying. So we decided to use a little bit of our rainy day fund. We decided to use $3.1 billion of that. Well, Rick Perry is fighting us on that. And what else helped us get into this problem is reduce sales tax revenues during recession years, decrease property taxes, both because people don't own as much property due to foreclosure and the housing thing, and just a dysfunctional margins tax system. We have a way to get every business to be exempt from taxes that there is. If you're a sole proprietorship, a general partnership of entities, you can just be exempt from almost anything. So we could have a lot more businesses paying taxes than we do. So we set ourselves up for this shortfall, and it doesn't look like it's going to get any better. And our governor, he's very tall, he's very nice looking, but compassionate, not so much. So this year he's taking a cuts-only approach to our budget. He's not looking at adding any taxes or increasing revenue. He just wants to cut programs. And he's at the top. So to fight him takes a lot of work. This legislative study group said that the way the current budget, the first proposed budget is in, it would affect young children, students, the elderly, the poor, the disabled, and the workforce. It will cost Texas 335,000 jobs over the course of the next 2 years, and 44% will be in private sector. With job reductions and a struggling economy, disposable income levels drop, which lead to decreased sales tax revenues, and that sets us up for a cycle that's guaranteed to regenerate itself in 2013 when our next legislative session meets. I will go over some notable proposed cuts, because if I did the whole list, I would have to do it auctioneer style. There's 99% reduction for the Cancer Prevention and Research Institute of Texas. I remember Irv saying yesterday that the biggest cuts are in preventive programs, and that we're leading the way on that. We have cuts to fiscal programs, eliminating local continuing education grants, underage tobacco programs, and distribution of money for construction just to meet their basic needs. There's no funding for routine replacement of 911 equipment. There's elimination of the ethics education program, because we might know that these things are unethical if we teach them that. I think Martha just said cut on that one, so that's my first one.
Sorry, Ben was out of the room and he didn't get it on the blog. It's okay.
That's right.
And disaster funds to local agencies when they don't have enough money to do their own disaster planning. They're planning to cut that out as well. The Library and Archives Commission is being cut by 47.3%. That's a hefty chunk of money. And this program is one that provides reference materials and online databases to grades K through 12. It's just been eliminated. That is a sad thing. Texas will lose over $8 million in federal funding for fail to meet the maintenance of effort requirements. And we lose a lot of money on a lot of these cuts and fail to meet the maintenance of effort. On the Veterans Commission, we're cutting 10.9%, and that will come from claims reps, counseling, outreach and marketing, and veterans employment services. Now that's really sad, because more and more of our veterans are going to war, and they come back and they need counseling services, they need re-entry services, and this will cut veterans, the number of veterans that we can serve by 5,000 a year. And they'll have a harder time getting services and finding employment as a result of that. Medicaid is the state's largest healthcare program, and it accounts for 25% of the budget in Texas in 2010. Enrollment increased by 10% in 2010, with growth is expected to continue. Medicaid is guaranteed, Medicaid participants are guaranteed services, so if we don't fully support it, then the state automatically loses money on it. Currently, Texas ranks 49th.
Yay! There's one worse.
in per capita spending on Medicaid. And we only offer basic services to those eligible. And things that we consider optional are prescription drugs, rehab, hearing aids. We consider hearing aids optional in Texas. And there's a $45 million reduction in these optional services in the budget as it is proposed. I'm starting to make you feel good about where you live.
We're coming to Canada. Actually, we're giving Texas back to Mexico, and we're coming to Canada.
It's too cold in Canada for me. I got
Our governor wants us to secede.
Yeah, he wants us to secede from the union, so
Yeah.
we may let him, and we'll secede from him.
There are cuts in provider rates by 10%, and there were already cuts before, so this makes it even harder. What is going to happen is that doctors are going to stop dropping out of the Medicaid system, and so that people will have fewer choices in terms of Medicaid, and the ones who do take it will have longer waiting lists. So it's just getting ugly all around. You heard the last person from the Urban Institute talk about how great the food stamp program is, and it's 100% federally funded, so that's not impacted by the budget. But what is that the states are required to do the eligibility and enrollment, and we're putting less money into that. So that means that people will wait longer for food, and if you're applying for food stamps, it's because you're hungry and you can't wait. And in 2009, the state of Texas was sued because extraordinarily long wait times for benefits. If you come in and apply for emergency food stamps, you can't get your first appointment 6 months later, and that be okay. And here's one where we're number one by being number 50. Texas spends less on mental health services than any other state in the nation. And that trend will continue. Over 4.3 million Texans have a diagnosable mental health disorder. 25% of those are children. I'm joining the ranks because of this budget. Just for mental health services, there aren't enough community-based services available, and at the end of 2010, 10,000 people in our state were on waiting lists just to get mental health services. And if you reduce Medicaid coverage, you're going to have even fewer people who can provide those mental health services to our citizens. And of course, it doesn't make sense to do that because the average cost of community services or mental health services in a community is only $12 per person. In prison or jail, it's $137 to $285, and an emergency room visit, it's between $980 and $1,200. And does Rick Perry know that?
I don't think that sinks into him. No.
Do you know what the largest mental health facility in Texas is? It's the Harris. It's the prison. And then that's right. It's the Harris County Jail. 60% is 60% more expensive to incarcerate a person with mental health than it is to incarcerate a person without mental health issues. So it costs a lot more to incarcerate somebody who has mental health issues. Whereas if you treat them in the community, it's $12. It's not very hard to figure out. Increasingly, policemen are serving as our frontline responders to mental health issues. Let's see, in Houston, they respond to a mental health crisis every 2 hours. We can do better than that. There's got to be a place that people can go and have their services paid for and come out better than being arrested and then going to jail, and then we end up paying for it on that end. Yes?
One police officer responds to a mental health call every 2 hours, or that's the emergency call every 2 hours?
In 2010, Houston police officers detained and filed an emergency detention order on a person in a mental health crisis every 2 hours on average. It's amazing. But when you spend so little on mental health care, it's easy for that to happen. Texans will pay for mental health services, but instead of paying the $12, we'll pay the $1,200 a day it takes to have these people incarcerated or hospitalized, which is also very expensive. So, other notable budget cuts: chronic disease prevention programs are cut by 54%. Substance abuse prevention programs are cut by 8%, with tobacco prevention cut out altogether. Trauma care is cut by 18%. Healthcare reimbursements for the treatment of the indigent is reduced by 28% to county hospitals. And they take the brunt of the indigent in Dallas. Parkland Hospital takes most of that. No more vaccines for children. That meant that indigent children used to get free vaccines. They're eliminating that entirely. HIV and STD prevention programs are cut by $28.5 million, and family planning services are reduced by 11% as well. The Department of Aging and Disability Services, they're together in our place, is cut by 37.1%. A third of it is going away. And they fund adult foster care, community-based services, hospices, mental retardation services, residential care, and many other services for the elderly and intellectually and developmentally disabled in Texas.
However, there was good news yesterday, and I didn't even get to tell you this, and told Vanessa. The legislature yesterday decided that they would not cut Medicaid 37% for the nursing homes and community care, because of our hundreds of nursing homes in Texas, 2/3 of them are going to close because they are Medicaid providers. And with that cut, that 37% cut in what they would be providing, their margin is so slim, they operate on 3% margin, that they couldn't stay open. So they were planning their closings. And all of the thousands of people that were in those nursing homes were wondering where they were going to live. That didn't move the legislature. They absolutely had no understanding or care about that. What moved them were the business suppliers who count on business from nursing homes for toilet paper, forms, food, linens, etc. They were all losing their income too. They went and complained, and that's what reversed it around. That was absolutely the most amazing thing I've seen out of this session. So the nursing homes are still open, and now if we could just get them out of the prisons into the nursing homes, maybe we could work a deal. I don't know.
And I'm out of time, but there's a lot more that Texas has done to make sure that we would have a difficult time as it goes on. One good thing, in which criminologists find very odd, is that during the first 2 years of a recession, crime goes down. And I passed out this community trends report, and it also gives what Dallas is concentrating on. So if you would look at that and where the calls have come from, we started out with very few calls for assistance, and now we're almost at 500,000 calls a year. So people are really in need. So I've given you that, as well as what the unemployment rates are looking like in all of US, in Dallas and in Texas, and the crime rate, and looking at how that goes down. Unfortunately, they say that if the economy stays down for another year, crime will start to go back up. So, thank you. I am but a messenger.
Is it me next? Alrighty. Well, my name is Mickee Brown, as I was introduced, and I'm here with Jacksonville Community Council. And I'm going to spend some time talking about JCCI's response to our community, our region's concerns over joblessness. Every year, JCCI polls our community to determine what the important issues are, and unemployment and jobs continues to rise to the top. That was true in 2010 when the survey was done, and it is true again now that the 2011 survey has been completed. So I am going to talk about the JCCI study that was developed after the 2010 survey, which focuses on recession and recovery and beyond, and that we're about to wrap up in about 3 weeks. So I'll get started. Economic development in the broadest sense requires citizen input. That was one of the learnings that came out of that. In some ways it seems intuitive, but not so much sometimes. Topics like growth management, business development, public investment, regulatory processes, zoning, and of course job creation are not abstract. These policies and whatever comes out of those discussions affects everyday people. The fallout is about how we live, work, and play. When JCCI took on the challenge of convening citizens in Northeast Florida around this issue in the 7 counties that make up our economic development region, we were charged with talking about job creation and becoming a more economically competitive region. So it was this idea of short-term job creation. What could we do in 12 to 18 months to create more jobs when there's 45,000 jobs that have been lost since the beginning of the recession to present, and to think about long-term economic competitiveness with the idea that this was an opportunity to do something to prepare for the future. Whereas that discussion has not necessarily taken place before. When we started the process, there were 375 people, or there have been 375 people who participated in the process in our 7-county region. The study started in October of 2010. Participants have been diverse as far as what they do, not necessarily racially. As far as gender is concerned, I think it's skewed more male, older, white than we would have liked, but you cannot make people volunteer for this kind of thing, and people have other priorities. We've had business owners, lots of political leaders, academics, nonprofit staff and leaders, retirees, unemployed persons, and generally just some regular folks that like this kind of thing, want to have this discussion and learn more about how jobs are created. Different from what JCCI usually does. Everything is kind of Jacksonville, Duval County focused. This is a regional study, all 7 counties. What we decided to do was do these site visits in each of the counties. And that is a challenge and necessary at the same time, because Duval County, Jacksonville is a consolidated city government, 900,000 people. It's the urban center of the region. The 6 counties that surround Duval are rural, suburban, maybe exurban, but really very different than Duval County, but we're economic development region by proximity. The conversations, of course, would be very different. So anticipate, or starting with the end in mind and anticipating what would happen at the end of the process, it was necessary to go into the counties and have these site visits because we needed to hear what other folks were saying. It could not be Duval County centric and just focused on what an urban county would say. And that was a challenge, but it was good work. Still at the end of the process, as we decide or start to have this conversation about what it is that we will do to combat the issues that have been brought up, we've come to the conclusion that Jacksonville is the center of the universe in Northeast Florida, you know, and that's just the reality of it. So but the other the EDO leaders were in the room, and but I think they knew that all along. I think they were already ahead of that curve, rather than the people that live in the counties. If I live in Clay County, I live outside Duval, but I work in Duval County, and in Clay County where I live, which is very suburban, it's a bedroom community, and that's a bad word, you should never say that, but it's the truth. And we talked to the folks in the community, it was like, oh, I don't want to be Jacksonville, the crime rate's so bad, it's urban, it's scary, and I never go there, but that's where all the jobs are. That's where, when the economic development folks are going out to market to the nation or internationally, as they say, it's still Jacksonville, we're not Orlando or Miami, but that's what people know. They don't know Putnam County or Clay County, Orange Park, and Middleburg. They don't know those small kind of municipalities. So but as a resident, I'm very proud of where I live, and it's like, oh, Jacksonville's a bad place, but EDO folks know that that's the center of the universe, and that is our primary conclusion, which is fascinating. I don't want to miss anything. So during this process, what have we learned? We've learned that economic development is not it is the people that do economic development hold on to it tightly. It's something. It's like any, I guess, business or any kind of work. The people that do it, they don't share their secrets. It's because if you let the cat out of the bag, everybody would want to do it. I guess I don't think everybody would want to do economic development, but it seems so scary and lofty and different, and just the regular citizen couldn't possibly understand what all the pieces are and how it all fits together. And that's not necessarily true. We spent 20 weeks having conversations, first with the folks in the 7 counties, and then inviting the experts to talk and do seminars, really workshops to talk about the role of economic development, or public education and economic development, higher education and economic development, taxes, regulation and incentives. We talked about, what else did we talk about? I'm talking real fast and I can't think. We talked about workforce development and all those kinds of things. And I think once people heard all of that and put it together, it's like, this is not really scary, and this is something that citizens really should have a role in discussing, not when things are just terrible and nobody can find a job. It's an ongoing conversation that probably should take place, and community councils are a right place to have that conversation because of the convening work that takes place, which is my segue. There's 6 things that kind of bubble up out of that conversation that we've had, almost a test to not talk about economic development because it seems like it's scary, but really it is the work that community councils and conveners do, which is first the convening, bringing the right folks together, which we've done. Assessment, it's what is our current state? We have had some of that discussion and are still having that discussion, and even when that study process is over in several weeks and this advocacy and implementation of the study's recommendations start to take place, there is continuous assessment, because this whole thing with economic development and joblessness is dynamic. It is not static, so that will be continuous planning. What do we need to do now and how? We did that at the beginning of the study to have the discussion, but that will continue to take place as folks go out and talk to our public policy folks in the public and private sectors, or our leaders in the public and private sectors as policy is developed and implemented. Goal setting, also important. Investment, critically important. What are we willing to pay? Time, talent, treasure, public investment, private investment, individual investment, which includes public engagement at all levels. And for Duval County just went through its primary for to elect our next mayor, and public or voting turnout's terrible, 29%. There's not a whole lot of public engagement, or people don't feel like they can make a difference in their community. And now, for at least Duval County, our urban center, who becomes mayor is critical. It is a defining moment in the history of the city, where you have a very conservative candidate, and that's not good or bad, but he has a different perspective on where the community goes next, to our Democratic candidate, who is not really liberal but very moderate. But the very conservative candidate is an older white male, and the moderate candidate is a younger black male. I don't know what's going to happen with that. I can anticipate, but I don't know. It kind of depends on what the voters see as the future of that community, economically, socially, culturally. It really depends. But again, turnout was 29%. And that says a whole lot of things, but it does. We don't know yet. May 17th. We'll see.
So you've already had the vote?
We had the primary. There were 5 candidates, and it's general election. If somebody didn't get the 50%, then there's the runoff. So this is the runoff. Measurement, which this is kind of number 6. All of you are very familiar with this. It's the community benchmarking that takes place. So when unemployment is really great, nobody cares about the 3 or 4%, and everybody's got a job. But when the region's unemployment rate is almost 12%, then hackles are raised. This is awful. But those benchmarks are there. It's just, how do you get people engaged with the data, good times and bad times? And I guess you can argue that it's not important unless it's bad, but it's something that folks should really pay attention to. And how do you engage folks around the numbers at all times when things are going on, when we look at the number of jobs that have been lost? And then when we looked at the information earlier, where you look at unemployment for our white population, blacks and Hispanics, and those kind of ratios are true throughout communities. So if the unemployment rate for blacks is very, very high, but the unemployment for whites is really, really low, in good times, in bad times it's going to be worse. But maybe we should be paying attention to what's going on throughout in order to make some decisions about how we move forward as communities. What would I like to see more of? More diversity among our participants would have been great, especially young professionals. And part of this, the study's at lunch for an hour and a half. And so we're thinking, we're going to engage more folks because it's lunchtime, you take a long lunch, but that's not the case. But again, who's going to take a long lunch, when you could lose your job? You don't have that kind of leeway when things are tough. But, you try to create opportunities. We also had a blog up, but people don't really do that. They don't participate like that. It still is that face-to-face engagement. It really takes an extraordinary effort to get people to participate virtually. Though we had some of that, but the effort is ongoing, so that's something that we need to consider. And the reason that population was so important is because the conclusion is young professionals, we need to do a better job of attracting this young, well-educated populace that's going to help us attract jobs to our community. And I know there's some disagreement about that, but conclusion-wise, that's what the study committee thought. Better participation from those folks that lack the education, perhaps, or lack the skills to participate in this kind of high-tech, high-wage future workforce that most communities are anticipating for themselves or dream about. we've talked about, but we've not really heard from that population that has those barriers to workforce preparation. So we really needed to hear more of that. That would have been nice. And kind of, this is my personal, I really wish we would have had more of this. Greater participation from our, sounds like fun out there, higher, or something, from our higher education community. We just really had poor participation. We invited 10 institutions of higher education and we got 3. Our major university, our public university did not participate. Our historically black college did not participate. And we were just asking them to speak. We did not get participation from our private our private university. Just not a whole lot of participation, which was, we needed to hear about knowledge transfer and the relationship between job creation and research institutions. And we know it, but we needed to hear it. We needed to have that engagement, that dialogue. And the folks that participated, you can guess it was the community colleges, because that's where folks go to get that secondary training, or if I can't afford to go to college, it's cheaper for me to go to a community college. Those folks really came out, told us, oh, I gotta hurry up, I'm almost done. What was surprising? That the job creation in our region has been a function of marketing. Our region's considerable assets, they're wonderful, we've got great stuff, but we may need to expand the region to include those counties that have assets that we lack, including a major research university. And simply marketing the region is not enough, it's insufficient. We need strategic planning and strategic investment to build a higher quality workforce, to attract companies that pay high wages, and develop the small businesses that have evolved into these larger entrepreneurial firms that really do a lot of hiring. That was quick and I'm done.
Tracy?
Thank you, Ben. I'm a tech person, so I have to have slides. And so I'm Tracy Viselli, and I'm the community manager for pretty much a brand new project that just launched in Alexandria called Action Alexandria. And just to get started, give you background, a tiny bit of background on Alexandria. It's kind of a city of contrast. So we have low unemployment, we have average, very high education, high income, but you walk across the street literally from $1 million townhomes to public housing projects. So it's a very dense community, and it's full of kind of, the very wealthy and the very unwealthy. So we have, our own set of issues. In terms of human services, Action Alexandria is an attempt to create an online solution to some human services issues. So you'll see why I call it raising the barn in the middle. In a minute, when I talk about Action Alexandria, I like to talk about barn raising, because it's a concept that people kind of understand from the old days. And so the idea behind barn raising is we recognize as a community that there are things that are common good, and we all pull together. We all recognize that, and we pull together to do something about it. We pool our resources, and we build ourselves a barn for the family next door, because that's something we recognize as a common good. So there is a formula for barn raising. If you didn't know, go ahead. And it's community needs plus limited resources equals organized collective action. So we've been doing it forever in communities, and it's really still the solution now. Communities are more complex. Just to give you we all know it's a lot more complex now, but the principle for barn raising is still the same. It's still the same formula. Communities still have infinite needs, finite resources, and the solution is, how do we get people to pull together to help solve the problem? So it's good. You can go ahead. So Action Alexandria, like communities around the country, we were faced, it hit in 2008, 2009 with the recession, kind of a rush on the resources that the community needed, and the community had fewer resources to meet the needs. So the Community Foundation, we're an initiative of the Community Foundation, convened community leaders, to talk about what can we do. They embarked on a year-long assessment and asked, this is right after 2008, the Obama campaign, and so people were thinking about technology and how can we use the social web to maybe solve some of these problems. So could technology help? Yes, the answer is yes for our demographics. So if you go ahead, oh yeah, some of the reasons why. Communities are moving online. I won't go through all of these, but even when you think about, in Alexandria is known for this, we have 50 strong neighborhoods with civic associations, and they all have listservs. They're all communicating. They're all using technology to communicate. So people are moving online, and so how do we take advantage of that? There's almost 500 million, or is it 500 million people on Facebook? Everybody is moving online. So what can we do to leverage that? So technology-aided barn raising is what how to think about Action Alexandria. What we're trying to do is use the social web to mobilize citizens to take action in the community, to increase local philanthropy, and to increase civic engagement. And so, goals, I kind of went over those. But really the keys are, we really want to use online to create offline engagement. So we're not trying to create a technology solution that only happens online. We're trying to get people to do things offline, and to increase civic engagement and local philanthropy. We're trying to create a clearinghouse of opportunities to help. So when people think, what can I do in my community? They can go to Action Alexandria and find something to do. They can search by their neighborhood. They can search by a category. If you want to do something education-oriented, you'll be able to search for that and find it. And then, probably most important for this group, we're trying to create a platform that any community can adapt. That's one of our main goals, is we're creating an open source technology. I've already had talks with a lot of communities about this, that they want the platform. And that's one of our most important goals, is how we're trying to create something that other communities can easily adapt. So partners, an initiative of the Community Foundation, but the City of Alexandria is also a partner. They put money, skin in the game, and we got a Knight Foundation grant. They have a Community Information Challenge grant, and so we were a winner of that grant 2 years ago. And it's a matching grant, so we got some help from Private Family Foundation, Community Foundation, and the city, and so we're able to pull together the funding for the project. So how it works and what we do in terms of human services, we do kind of two main things. We target urgent community needs, and so I, as the community manager, basically have gone out to the nonprofit community and sort of sourced urgent needs, kind of gathered things they need help with. And then I take an urgent need and I kind of package it online. So I figure out how can we make this work? How can we motivate people to help? So, and people can take an action, and then we're also empowering people to start their own actions, and I can show you more about that later. An example of an action would be, our first action was for a local homeless shelter, and what we decided to do was they were having trouble, they had a lot of more children living at the shelter, and so one of the things they wanted to do was they needed help with providing after-school snacks because they had a tutoring program. And so our first action was to help them pay for a month of after-school snacks, and so that was $500. We tried to raise $500, found a matching sponsor, and then eventually we were able to help them raise $1,500. So our goal was 1 month, but we helped them generate 3 months worth of after-school snacks for children living at the shelter. So that's an example of an action or an urgent need that we're trying to help with. Challenges are the more long-term thing, and we were talking earlier, our first challenge, which people can help solve by submitting ideas, was a community quality of life indicators project. And so we provided online functionality for citizens to come and vote and help prioritize the indicators that they thought were most important to them. So it was we had in-person town halls for people to do the same thing, but then we had an online component as well. And so we're now actually preparing a report. We're combining the town hall feedback and the online feedback to report back to the community. And so organizations can sponsor challenges. So a city department could sponsor a challenge, a nonprofit could sponsor a challenge. Citizens or organizations can suggest a challenge. We're sort of open to anything. And anybody can solve the challenge on the site. So, and just so things that citizens can do, we're creating opportunity for citizens. They can take an action, they can start an action. We're providing infrastructure where in my neighborhood I have a park and it's dirty and I decide I want to get a bunch of my neighbors together to do a park cleanup. They can do that on the site. They can start an action and people in their neighborhood search and find that action in their neighborhood and go help clean up the park. They can solve challenges, they can suggest challenges, they can post events, they can submit content, and they can support local organizations, literally by clicking I support this organization and helping build support online for that organization. And then for organizations, what we're doing is creating infrastructure. So Alexandria has a lot of really small nonprofits that don't have a lot of technology infrastructure. So we're giving them a way to share content, to start actions, to post events, to sponsor challenges, and submit content. And most important for them is to gain supporters. So people find them online, didn't know about them, and can sign up to be a supporter. And for our first group of actions, we've actually found that while an organization gets their traditional supporters, they're finding 20 to 30% new supporters with every action that we work with them on. So it's a valuable resource to find new supporters. So just kind of results since launch. Right now we have 280 registered members. You have to register as part of our kind of long-term evaluation. We actually ask for a lot of data up front for a demographic information, what neighborhoods you live in. And so there's a little bit of a hurdle to registering for the site. And we run 6 featured actions so far. There are 12 community actions, that's started by a citizen or an organization. And we've had 117 individual actions taken, and that's really not, it doesn't tell the whole story because we're relying on people to click a take action button. What we found is that, for instance, we did one action where in a week we did a diaper drive. People donated 2,500 diapers. I mean, it was a deluge, diaper deluge. It was really crazy. But only 9 people clicked on the take action button. And we know 9 people did not buy 2,500 diapers. So it's kind of really an untold story, and that's something we've got to figure out. We've got 40 organization pages so far. We've got sponsored for some of our actions. We have one sponsor who's been great and has given us $5,000 for the entire year to help provide matching grants for our featured actions. And we are right now working on developing a community of bloggers for the site to help you write content. So, and then just for the featured actions, I talked about Carpenter Shelter. We were able to triple our goal for Alive, which is a local faith-based group who does a lot of food distribution. We were able to generate 30 bags of food, and they were able to feed 2,400 people with that. 2,500 diapers, and these are all just week-long actions. And for a local pediatric clinic, they use Pedialyte in the waiting room when people bring in sick children suffering from dehydration to prevent them from getting more seriously ill. That was big need they had, so we were able to help get people to bring single servings of Pedialyte, which are actually really hard to find. This is something that we found. And then for a Friends of Guest House, which is a women's shelter that helps ex-offenders kind of integrate into the community, we were able to raise $1,000 for basic needs. So, and 901 votes in our first Quality of Life Indicators Challenge. So we have been able to mobilize citizens to do, sometimes it's raising money, sometimes it's dropping off food, so we're trying to mix it up, donate money, do something in the community, vote, help us prioritize indicators, trying to do a lot of different things to get people engaged. I think that's probably it. Yeah. And so if you want to see the site, and that's actionalexandria.org, and you'll kind of see that it's divided up into Act Now and Solve a Challenge. And those are kind of the main things when you go to the site, if that's what you can do. When you click on Act Now as a citizen, you can see the actions that are live that you can decide that you want to take, and you can search by neighborhood or category, etc. So, you know, we're kind of a private-public solution to human services problems in the community. So.
One question I'd like to ask you all, and then throw it open for others. And Tracy, you might start on this because you talk specifically about engaging the business community here. How are you all finding, as you look at the planning function of community planning councils, which we don't do anymore, but even pretend to do, how do you look at aligning the sort of the public side, the public purpose, or the charitable purpose with regard to the Knight Foundation, with where the business community is going, not in their civic side, but in business deals that are being put together that result in investments that produce jobs, produce goods and services? Is there any connectivity there in the work that you're doing, whether it's on the advocacy front or on the planning front or in your project here in Alexandria?
Oh, okay. So I think one thing we haven't been able to do, I'm the only staff member on this project, by the way, so I preface that by I'm the one trying to engage the communities. Business is a sort of glaring hole we have right now. There have been some attempts, but I mean, I think, you know, one of the ways that we sort of integrate into kind of a longer economic development strategy is, you know, that we do impact the quality of life in the city, and are helping to sort of, we're helping measure quality of life as well as part of the city and the community efforts. So I think we're, you know, if the project is successful, we're in the process already becoming integrated into a lot of the city planning, and we offer functionality to help the city plan. So we're kind of, you know, in a way maybe becoming embedded in the process.
Mickey or Jacqueline?
There's an odd thing going on this past year. There's a lot of folks still moving into Texas. That's where some of the Northeast population has moved to, the Sun Belt and whatever. So we still have an in-migration and a lot of effort going on to bring business into our community. When they bring the businesses in, one of the things that is just starting to pop up is senior housing, because people are concerned not only about the workforce now, but some of their senior relatives. And the need for affordable, I hate that word, senior housing. The business community is concerned about all what used to be all the relocation services for families and friends coming into the workforce, and now that includes this senior housing piece. The developers, who used to make a fast buck putting up houses on spec faster than you can imagine, aren't making a fast buck right now, so if they can build senior housing and get any kind of a tax break, it's on their agenda. And on our social agenda and senior agenda has been, what the heck are we going to do with people when they can't live in their big house? So there actually has been the beginnings of those three elements between the business community, the senior community, the relocation community, the building community, and the social community coming together. And looking at, it's a priority for all of those segments, but for different reasons. So there is some motion on that for the first time, and Mary, I think you're seeing some of that in the transportation sector also. Some motion coming together on that, but it's just a very small inkling on where business has its priority and wanting something that it can't provide for its people, but it wants to bring people here.
For this particular project, I would say that the interest of business and planning are very much aligned. The study is sponsored by the Workforce Investment Board for our community, and Cornerstone Regional Partnership, which is the Regional Economic Development Initiative of the Jacksonville Chamber of Commerce, the regional chamber. So those, it's great alignment there. And then as we look at the study process, just by the folks that have been involved, The two outcomes, it's becoming a more pro-business region. I don't know what they're going to recommend yet, but that is the conclusion. And then to focus on creating a better quality of life for the attraction, retention, and creation of business.
Well, for you all, or for anyone else in the room, let me posit another question, and that has to do with the knowledge economy. Bill was alluding to this a little bit earlier, investments in knowledge and so on. I don't know about your communities, but I know the numbers for Cleveland. We have in the neighborhood, this is in a population now of under 400,000 in the city of Cleveland, roughly 60,000 people who have felony records. Most of them, the largest by far and away number, African-American men. That's a big number, proportionally in the population. There is, in effect, very little opportunity for them in the knowledge economy of healthcare, advanced degrees, and so on. Our workforce board, which has had tremendous success doing what you were just talking about, aligning their work with the business community in recent years, that is, treating businesses as the client rather than the population as the client. The good news is they've had some luck with that. The bad news is the people who most need the jobs ain't even in the line. I mean, it's just that there's a complete disconnect there. So for you all or for anybody else, through workforce systems or other, how are you getting at some of those hardcore issues that lie down underneath? Again, aligning that public side with the business community and its needs. Yeah.
Well, I want to throw a couple of things out. We've been doing a lot of work with other communities as well as our own. And one of the things I've been asking them is, what are your visions for your economic development? How are you going to, what's the new economy going to look like for you? And almost universally, if they have any kind of military presence, it's, we want to strengthen our military presence. We want to, engage in biomedical research, science. It's the health sector stuff, right? And not if you're hearing all this. The other thing is, we see ourselves as an incredible place for logistics. People with a port talk about ports. People without a port talk about how their airport is a port. I was in central Indiana, and they were talking about how they were going to be a logistics hub. I'm like, you're in the middle of nowhere. I don't know how you can deal with it. But in all of those, when you're dealing with felony records, it's going to keep you out of the military and any ancillary military services, including military supply, and it's going to be really hard to get it in there. Healthcare, forget about it. And then when you're dealing with logistics and transportation, you're running into, especially you get ports, airports, anything like that, you're dealing with Homeland Security, and it is excluding anybody with records. And so when you're seeing your dreams, your growth industries in your community almost universally are designed explicitly. This isn't convincing somebody that you can take a chance on somebody with a record. This is explicitly excluding people with records. And yet that's where the needs are for finding people with jobs. We've got some great nonprofits and some great faith-based groups that are doing some exciting things with trying to do ex-felon reintegration and services for ex-offenders, and we've got all of these pieces in place, and we hit that question of what actual jobs can people do, and the ones that don't require any kind of security clearance are disappearing. Anybody who has any children who go anywhere within the sniff of the organization, now you can't, liability won't let you take anybody. So it becomes a lot harder, and at the same time, when we're talking about automation, it's not just robots building cars, but it's also, pay at the pump, it's swipe your own, it's your self-checkout lanes, it's all of those things that have taken out a lot of those, just simple cashier and bagger jobs are disappearing as well. So we've got some projects, we've got some people who've done some neat stuff, and then lately it's just killed them.
We have a comment from north of the border here.
It's not a total response, but one of the things that we're finding very much in Toronto is this kind of hollowing out of the middle in terms of the economy. There are the high-end jobs, and there are the bottom-end service jobs. Everything in the middle that used to be the manufacturing sector, any of those pathways out of the bottom towards the top are vanishing. So one of the things we're really having to focus on is what are those pathways out of the bottom end jobs, and that, you know, that's part of what we're driving at. One of the things we're hoping will at least be a partial response to it is the green economy, and I know that that's been something that that's in many ways is also had a genesis in the States in terms of retrofitting houses, in terms of solar panels, all of that whole kind of energy economy does provide a way of training people with limited skills, social purpose enterprises, and where you've got a climate, that encourages that kind of thing in terms of differential energy pricing, in terms of some of the incentives that I know exist in the States, that provides an opportunity for social enterprise, bringing together in some cases the private sector, in some cases the community sector, and in some cases the public sector, getting electrical utilities, for example, to get on board with this kind of thing. We've got a real focus now on getting schools putting solar panels into, onto their roofs in terms of generation of electricity. But all of those kinds of things, that is one area of potential economic growth that I think can be looked at, and that, you know, you don't need not to have a criminal record to be able to put a solar panel on the roof. Although in Canada we can solve that problem in a similar way to do that by putting all our criminals in the legislature.
Well, hollowing actually really a big term. That's what's happening. There's one thing I want to mention before we close, then over here, and that is that, you know, we've had a lot of talk about the hollowing out and also the polarization of incomes. One of the things, we did a big study on state finance last year, which is a story in itself. But one of the things that we pulled down from national data that is a shocker, and a little bit of one of these, hold it for a minute, let's be careful of our rhetoric here, was this, that while we've seen for 30 years stagnation of middle incomes and polarization on the income spectrum, with the rich get richer and more people kind of sliding down. But we've seen at the same time in terms of taxes paid, and you'd expect this in some ways, but in other ways it's a sobering number. The proportion of federal taxes